Well, this Monday, we're joined by Dr. Ryan Turley, a local vascular surgeon here in Austin. Thank you so much for being here, Dr. Turley. Now, according to the Cleveland Clinic, DVT is the third most common vascular disease in the U.S., but Wemby's diagnosis is unique. Can you tell us more about that?
Yeah, thank you for having me.
Sure.
It is unique. So, in fact, there's about 100,000, there's about 100,000 DVTs diagnosed every year in Americans, okay? About 100,000 of those actually can embolize and go to the lung, cause PEs. Only about 4 to 10%, based on what literature you read, are in the upper arm. And they're a little bit different from the lower extremities, because the different arm is usually in younger patients, and usually there's an anatomic variant called thoracic outlet syndrome, makes them a little bit more vulnerable to DVTs in the upper arm.
And we were talking about risk factors. Can you kind of allude to
Sure.
who is more at risk for DVT?
Sure. So in general, people who are at high risk for DVTs are people who have a sedentary lifestyle, people who have a genetic vulnerability. There's different genetic abnormalities that cause that, or people who've been injured or have other inciting factors. But those are normally in your lower extremities. Okay. Now, people who have upper extremity DVTs, it's usually in a phenomenon called thoracic outlet. These patients are usually younger, and they usually have an anatomic variant, which kind of narrows the aperture between their first rib and their collarbone, where the vessels come out, and cause compression. It can lead to a blood clot.
Now, we were talking about certain athletes are prone to this, like pitchers and basketball players, right?
Exactly. So any athlete who has repetitive arm motion can have develop an upper arm DVT. It's a classic medical school question. Is the pitcher who has a big night and has a swollen arm afterwards? It's called Paget von Schroeder syndrome. That's a classic example. Basketball players, especially, it's on the same side of their shooting arm. You know, actually musicians can have it too. It's not uncommon to see people who play guitar, people who have repetitive motions of a dominant arm who have an anatomic susceptibility can form an upper arm DVT.
So, Dr. Turley, what can we do? What signs can we look for, and what do we need to do?
So, and unfortunately, there's probably not to do for young athletes who have it. This is just something they're born with, and they don't know until they get older. It's usually from extraneous activity. There are some things you can do to kind of minimize that risk. Make sure you stay hydrated, okay? Very good to stay hydrated. Good stretching, good post-workout routines, pre-workout routines. For leg DVTs, there's more protective things we can do. One is if you have a family history of blood clots, some of your family members have blood clots, go see a doctor. You may have a family susceptibility, a familial susceptibility. You may warrant some more medical therapy. Frequent walking. You know, if you're going to be in a car ride, I recommend stopping every couple hours, really walk around, move your legs, move your arms. Airplane rides are a classic example too of an airplane. Really try to consider doing calf pumps. When the seatbelt light goes off, consider going out walking around, especially on very long international flights.
There you go. And just one final question. The producer made sure that I asked this. Do you think Wemby is coming back next season?
Next season? Oh yeah, absolutely.
I think this is. He's very happy.
Yeah,
now.
I am too. I think he's a great player. Go Spurs. We need him on the court. Absolutely.
Dr. Ryan Turley, thank you for coming in and enlightening us about that.